Well, good afternoon and welcome to yet another Texas Public Policy Foundation live stream. We've been talking about everything related to the longest decade of our lives, also known as the year 2020, covering things like data transparency regarding how many people have been sick from COVID-19 and how many people have recovered. Last week, we talked about education policy. We've talked about making sure we understand the proper history of this country, civics. This week, we're talking about something that affects all of us, every single one of us, regardless of our age, regardless of where we live, regardless of where we are on the ideological spectrum, regardless of whom we're voting for in November. Healthcare affects us all. And in fact, for those of you who make a habit of tuning into this live stream each week, we know that we want to give you the tools for understanding the problem that we're tackling. In this case today, the problem is healthcare writ large, but specifically a lack of transparency in pricing. But then we also, of course, want to give you some solutions. And in the first half of the conversation with our experts, I'll ask them some questions that will sort of set the table for a conversation that we want to have with you, our audience. So if you already have a question for any of our experts whom I'll introduce here momentarily, you know that you can go into the comments section of whatever social media channel you're on, and our staff will get them to us. So without further ado, it is just such a pleasure to sit here, at least virtually, with three friends, people who are real patriots when it comes to trying to put more freedom in your hands when it comes to healthcare generally and pricing in particular. We're joined by Cynthia Fisher, who's a very successful entrepreneur, also has been heroic when it comes to arguing for patients' rights. She heads up a patients' rights advocate organization. She'll talk to us about some of the legislative and grassroots advocacy she's done. Cynthia, of course, is going to bring to this conversation what I like to call the sidewalk level. What does this look like at the sidewalk level when each of us is walking into a doctor's office, or at the sidewalk level when we've checked our mail and we see those bills that are waiting for us in the mailbox? We're also joined by our longtime friend, former official in the Trump administration, Brian Blase, who now heads up his own business, Blase Policy Strategies. Brian is, I would say, even though he's a humble guy and wouldn't admit to it, the leading expert when it comes to understanding how we put freedom and free market principles back at work in healthcare. And of course, I'm very biased in the last introduction I'll make because I get to introduce not just a colleague at the Texas Public Policy Foundation, but someone who's become a good friend. We're separated by a mere 3 doors, which means that David Ballot is a very patient guy. Usually he and I would be sitting in our offices in the mothership in Austin, Texas, but we're up here in the nation's capital, sitting a few doors apart because we're not allowed to be occupying an office with 2 people and not have a mask on. So we'll cover that another time. Today, we want to talk about healthcare price transparency. So David heads up our Right on Healthcare effort. So to Cynthia, to David, to Brian, thanks so much for making time for this afternoon. We're going to get started and jump right in, which is what we like to do. We're in the think tank business. As people like to say, we analyze problems, we like to come up with solutions. And then, unlike some think tank kind of organizations, we don't want to just sort of look at the beautiful white paper. We want to go see what the white paper advocates be put into action, be put into legislation. And so that's what we're going to talk about today. So first couple of questions before we get into the specifics of price transparency are questions I think that are on the minds of lay people who are paying attention to this policy. And that is, what's wrong with American healthcare? And then secondly, what in the world can we do to fix it? Cynthia, we'll start with you.
Well, thank you so much, Evan, for this opportunity and on what's so critical to the American consumer. And frankly, the American consumer is not just the patient, but it's the American worker and the employer and the taxpayer, because we pay for healthcare. And what we've seen over the past many years, especially over the past decade, is we've seen so many people, either we ourselves know of someone or ourselves have experienced it firsthand, outrageous pricing in medical bills received way after the point of care. And so many Americans have been crippled with this devastating debt. And why is it? We've been blindsided by this medical debt and this outrageous pricing because we never get to know prices in the healthcare marketplace before we get care. So what Patient Rights Advocate has done has brought the voice of the American consumer to Washington. And essentially, it is a nearly 90% issue because the Harvard Harris poll and 2 other polls in this past year alone have shown us that nearly 90% of all Americans agree that they want hospitals and insurance companies to reveal the discounted cash prices, as well as all of the negotiated rates wherever we get healthcare. So throughout the healthcare system, it is a bipartisan issue where nearly 90% of Americans agree. I mean, Kevin, what other issue in our country right now do we have over 90% support, right? Where it's unified to have healthcare price transparency available for all Americans. And, you know, David Blade and I and Brian, we've had so many conversations that consumers actually want to be in control. They want to be in control of their healthcare decisions and their very precious hard-earned healthcare dollar. And the only way we can be in control is to do what we do in every other facet of our lives. And that is that we are consumers that benefit from competition and the ability to shop. But you can't shop for value, which is price and then ushering in quality, right? When we shop, we compare quality and we shop for the best quality of healthcare at the lowest possible price, the cost to us, when we can see prices in healthcare. That's game changing. That's revolutionary because that would put healthcare on par with every other facet of our lives, where we would benefit from competition driving up quality and innovation while driving down the cost of care and coverage. And today, with this COVID crisis in this year of 2020, it's enlightened us to these outrageous bills where one can go for a COVID test, for example, that's for free in a tent set up in a city. Whereas if they go to a tent outside of the emergency room, they have no idea that they're going to come out with a $6,500 bill weeks and months later for all sorts of charges that they never thought they would encounter for their free COVID test. But this is not just a new problem. I think what the COVID crisis has shined the light on this issue is that this has been an issue for cancer, orthopedic surgeries, all across our healthcare system. People have had outrageous price gouge bills with no say. And you know what's really encouraging is we have tremendous positive momentum with the Trump administration executive order and rules that came forth. However, the hospitals sued in the courts, and yet we won the first case, but now it's back in the courts in the appellate process. But now we have legislation in both the Senate and the House for the Healthcare Price Transparency Act, led by Senators Grassley and Braun in the Senate and Flores in the House. We could actually see in this next stimulus the cure to the broken ills of our healthcare system by putting this into law at absolutely no cost to the taxpayer. So I'm happy to be here today because it's a very critical moment of time, and it is an opportunity that sits for all Americans to win on this issue.
Well, Cynthia, I asked you to set the table, and I just have to say you did a marvelous job of setting out the table, covering all of the topics we want to probe today. And I'll also say, I just want to underscore one thing before turning to you, Brian Blase, for your comments as someone who is on the inside and is now on the outside, although still very involved. And the one thing that I want to highlight of Cynthia's comments is your comment that we're at a critical stage. We hear that often. You know, those of us who live outside DC especially, we might turn on the news, we might hear our senator or our congressman say we're at a critical stage, to the point that that is almost meaningless. But it is absolutely true on this issue of price transparency that today we're at a critical stage on this. And so we're hopeful that our ensuing conversation can arm, so to speak, our audience members to help out, especially considering, as you said, more than 90% of Americans agree that something needs to happen with this along the lines of what we will spell out. If only we would have more issues with such agreement, right? So Brian Blase, you've got a unique perspective among the four of us about this because you've been on the inside and now still a very influential outsider, if you will. Just want to give you the opportunity to explain to our audience your perspective about this issue of price transparency and how it connects to the larger problem that consumers are facing in healthcare.
Hey, thank you, Kevin. Thank you, Texas Public Policy Foundation. Thank you, Cynthia Fisher. Cynthia is really the leader in this movement and getting price information to American consumers. I think you started by asking what the problems are. I think Cynthia's answer was very articulate. I will just re-emphasize certain things. I think there's two big problems. One is that consumers aren't in control. Lots of third-party middlemen have enormous power in our healthcare system, and they don't necessarily act in the best interest of the consumer. The government sets payment rates through Medicare. Insurance companies have enormous power. 90% of what is paid to providers goes through insurance companies, which really serve as a disconnect between the consumer and the provider. I think we need to, in sort of thinking about how we can reform America's healthcare system, we want consumers to be in the driver's seat. We want providers to have to serve consumers, and that's going to happen through competition, where there's competition between providers and where high-cost, low-quality providers are outcompeted by their competitors that provide better value to the consumer. Right now, our system isn't set up for competition, in large part because consumers and employers don't know what prices are. If consumers and employers knew what prices are, they'd be able to discipline the market, and you would have providers responding to that competition. And I know we're going to get into this further, but you see evidence that this works, where consumers with information, with incentives, act as cost-consciously individuals like they do in the rest of the economy, and providers respond and they offer lower prices and better quality of care. So if we're thinking about reform through empowering consumers and employers, it starts with arming them with information that they can be shoppers like they are throughout the rest of the economy.
Thanks, Brian. It reminds me, as you were talking about the importance of consumers having access to completely transparent pricing, that sometimes the people who stand in the way of that are hospital administrators, which is not to throw them under the bus as a class of people. We respect the jobs that they're doing, but it's also true, and 95% of Americans agree, that they can be doing a better job of aiding here. And so it's very helpful that we have with us our good friend David Blase, who used to be a hospital administrator. And we're grateful for his service in that regard. We're particularly grateful for David's perspective based on his experience in that former role in being such an advocate for price transparency. So David, I know that our audience would love to hear your perspective also from the inside formerly, and now working from the outside to achieve this policy win.
I believe that many people that get into healthcare, even on the administrative side, got into that profession to contribute to patient care. That was certainly my motivation. And the reason I used to be an administrator is I didn't feel that the system was allowing me to fulfill that mission. So it was just very disheartening, which is why I'm now sitting in the chair that I'm sitting in now, is to be a part of the solution and to give the patients the empowerment that they so badly want. Americans worry really about two things. They worry about access to healthcare for two reasons, I should say. One is getting the care that they need, and the other is that they don't create a financial burden for the generations that follow them. Now, that anxiety is rooted in the fact that, as we've heard again and again, it's a lack of control. And 90% of people are saying, we want that control. We want transparency. And so people are tired of giving that control away, and they want to be a part of changing a rigged system. And that's what we have. It's not a system that functions like normal business and is protected by government. And so that's the reason that what we're doing and what we're talking about today is so vitally important to make healthcare more affordable again.
Well, thanks, David, for that. We'll come back to you in a little bit about the role of hospitals in the larger problem. But each of you in your own way talked about the system. In fact, I think if my recent memory serves, over the last 15 minutes, each of you talked about each group of people who has some role in the system: consumers, doctors, hospital administrators. There's this large sort of amorphous abstract thing, the system, that I would like to sort of push each of you to define for our audience. And the reason I want to do that is I think it's going to really underscore the problem that we're facing. So Cynthia Fisher, what is the system? Who is the system, and why is it such a problem?
Well, currently the system of healthcare has layers and layers and layers of opacity. It's like dark curtains put in front of the patients. And, when we shine the light and we pull those curtains back, you do what we've all mentioned in this thread is you empower the patient. And you give them control that they can actually compare. Because in this healthcare system, we have a wide range of price variation. And in the price variation, that variation, as according to Dr. Larry Van Horn, a health economist from Vanderbilt, he looked at the historical claims data and he saw that the cash prices in a given market are classically 39% lower than the negotiated rates. And that's not just within the system and within the market, but that's also within the same hospital. So when you could get an MRI for 39% less at a cash price in the same hospital from the same people and the same quality of doctors, why wouldn't we want to know the prices that we could do that and not only save the individual and their families and come up with new ways of reimbursement of medical costs, right? Why not at a debit card kind of level that you're just paying cash at that low rate rather than prepaid medical, essentially, which is insurance. So if you think about the possibilities of empowering a consumer with that knowledge, you can imagine how easy it will be to drive down not only the cost of care and coverage, but it will drive down all those total costs to the consumer when they can see, quote unquote, the system. So I would say that people would no longer fear, which we know 64% of Americans right now fear going to the hospital for fear of financial ruin. Well, the only way you can have and restore trust and accountability is for that system to compete and show their prices and act like every other business in our economy to compete for the consumer's dollar and choice. So that's how I would see the system, as it were.
It's, I guess the metaphor would, or analogy would be, if we grocery shop the way the healthcare system works, we would drive up to the grocery store parking lot. We would have some other people sort of give us the list. They would bill us, and it would take 62 days to arrive, and we will have paid 40% more for our groceries. Whereas our neighbor went in and did their own shopping and paid cash and paid 40% less. And just think about that on a gallon of milk. I don't want to pay 39% more for a gallon of milk, especially with a bunch of kids running around my house drinking a bunch of milk. But with healthcare procedures, obviously we're talking about things that are extremely expensive, in the 5, sometimes even 6 figures. We're blessed as Americans that we have access to that. We're blessed as Americans that we have access to the grocery store of our choice. What we want to do is make it even better and make it completely transparent. So I really appreciate the way you framed it. Brian,
Kevin, if I may, because you use the gallon of milk, which is just, a great way of visualizing this. But can you imagine for the person you referred to first, who had to use a third party to be the intermediary, can you imagine for that gallon of milk that as soon as you stepped into that grocery store, that you'd have a facilities fee? And then if you went into the wrong line at the cashier, you'd get an out-of-network cashier who would charge you with their own bill many months later, much, much higher than the gallon of milk itself. So, it is quite ridiculous, but thank you for using that analogy.
Well, as an avid grocery shopper, because I like to cook so much, I'm imagining this dystopic novel about grocery shopping that it maybe will persuade the 5% of people who don't want more price transparency in healthcare to join this effort. So we don't want to belabor that analogy anymore, but thanks for humoring me, Cynthia. Brian, what would you say about the system for audience members who are trying to understand exactly what that means?
I'll take one aspect of the system, which is the role that health insurance companies play. So in health insurance is, as Cynthia said, it's largely the prepayment of medical care. And the federal government heavily subsidizes people to get comprehensive health insurance so that transactions run through their health insurer. Now, health insurance makes a lot of sense. there's a lot of low probability, expensive events that people should have protection for. And health insurance, classically defined as insurance, makes sense there. But we have so heavily subsidized health insurance. And and I'd say this is more, I have come to this revelation over the last couple of years, but there's this belief that health insurers are out there and their primary motivation is to get good deals for consumers and employers. And I no longer think that's true. I think that health insurance companies benefit the higher healthcare spending goes, largely because they get a percent of the premium dollars, and they play this discount game with employers and with patients, where they show what these made up billed charges are that the hospitals or the providers have listed. And then they say, thank heavens you have the insurance because we saved you, 50, 60% off these billed charges. And I think one of the main benefits of price transparency is to lay waste to this discount. And we need to have employers get the information about what these prices actually are, see the variation across the country, like Cynthia pointed out, see what people are able to get if they pay in cash, so that we can really shed some light on this whole system that we have set, where the vast majority of our spending is run through health insurance companies, which, when we do that, think about the administrative costs on like simple things that people should just be paying out of pocket. They would get savings, and we wouldn't have to go through this sort of rigmarole of bills and follow-ups and sending things into collections, which is, it's not what providers want to do. I don't think most providers want to send people to collections. And that's one of the things that most frustrates people, is that they get these bills that are incomprehensible and that seem to go on forever.
And then they have to call the insurance company to ask a legitimate question, and there are just scores of complaints about either not being able to get through, especially right now, or getting different answers from the same company. And there's such a frustration. I think all of that points to scholars who review large systems of any type, a system that's simply too big and too complicated. So David, why don't you put the exclamation point on this thread for us about what the system is and how can we try to begin to tackle it? And then we're going to pivot towards some solutions that the three of you have been working on.
As it pertains to the system, let me make a statement and then let me paint a picture. The statement is, if you want to know who is a part of the system, look to see who is spending inordinate amounts of money on trade groups and lobbies in Washington, D.C. and your state capital. You'll then know who the participants are in that system. But if I were to paint a picture, let's talk about what healthcare is. Healthcare is the relationship between doctor and patient. So the system that we have today has created just an innumerable number of middlemen that have injected themselves between those two parties. And they've created this gauntlet of obstacles that the patient and doctor both have to go through in order to do the thing for which they did perfectly fine before those middlemen got involved. So it's just a complication, an unneeded infusion of complexity in something that is as basic as a relationship between doctor and patient.
Thank you. So I think that all of you have done an excellent job of setting the table as it pertains to what the problem is. And you've done that in a relatively short amount of time. Obviously, we could take hours to talk about all the different aspects of the system, but we're not going to do that. We really want to, especially in the second half of our conversation, talk about solutions. And so I want to come back to each of you in order for you to highlight the one or two major solutions that you've been working on, but particularly the solutions that are time sensitive right now, efforts that you're working on right now, and maybe particular things that our audience members, if they're so inclined, can do to assist you with that. Cynthia.
Well, right now we have an incredible opportunity with all the positive momentum that's been coming forward, one in the Senate and in the House, and that is the Healthcare Price Transparency Act. This bill in the Senate and its matching bill in the House essentially makes hospitals and insurance companies show the discounted cash prices and the negotiated rates across the system. This is a huge, huge win for the American consumer. when this comes into law. And with Mitch McConnell and Nancy Pelosi and Senator Schumer and Mr. McCarthy, Congressman McCarthy, Leader McCarthy, all at the negotiating table at what Congress is going to do in this next economic stimulus. The amazing thing is how important this Healthcare Price Transparency Act can act as a tremendous economic stimulus to every individual and family, and especially small and medium-sized businesses when it becomes law. So it's really critical that they put it into this stimulus. And the Congressional Budget Office, Kevin, has already scored it at no cost to the government. That means no cost to the taxpayer. Now you have to ask what senator or what leader would not want to do what's in nearly 90% of issue for all Americans, one of the biggest, if not the biggest, bipartisan issue of its time. And it is a time that has come. And in this pandemic, it's so critical that we protect the wallets and the wages and the precious dollars of all Americans. And it can easily be done, but we'll need advocacy of all of your viewers and listeners. And I would encourage them, if they want, to go online to our site, patientrightsadvocate.org, and they can simply click on a button and use their voice to support getting this into law right now in this congressional stimulus for this pandemic.
Thanks for that, Cynthia. So in case someone's interested, patientrightsadvocate.org.
Yes.
Okay. And knowing our audience well, in fact, knowing many of our audience members very well, I know that many of them are circumspect at best about another stimulus package. And so what I would say to them, and they know that I believe this myself, I don't think we need another stimulus package. What you're arguing for is that you want to use strategically the conversations that are going on about the stimulus package, whether they're right-minded or wrong-minded, and use that as an opportunity to advance this 100% good idea, which is cost neutral to the American people and in fact will benefit us individually. Am I understanding that framing correctly?
That's absolutely right. And it is a right, left, center issue, right? All Americans bipartisanly, nearly 90% have weighed in that they agree on wanting this and wanting it now. So yes, it is a time that has come. And as we talk about stimulus, if they did anything, this would be the one thing that they should deliver for healthcare. The Senate and the House, deliver it now, because it will make a huge impact and it will change the game to reduce the cost of both care and coverage. And people know when we can shop, they know that we'll shop for the best quality at the lowest price, and we'll keep driving down the cost through benefiting from competition. So this is a no-brainer, and it's a moment whose time has come.
Very well said. Thank you. So to put it into Texan, you can hate the stimulus and love the Price Transparency Act.
That's right.
All right. Brian, what would you highlight as reforms that you've been working on, but also perhaps reforms you've been working on that our audience members can play a part in helping?
Sure. So I echo what Cynthia said on price transparency. I've done quite a bit of work on that, and I authored a piece that was in Health Affairs last month that argued that if there is another stimulus package, that Congress should codify the administration's actions on price transparency. I mean, really, and actually, I can point. I have a Washington Times op-ed last week with Lan-Hee Chen at the Hoover Institution, and we make about a half dozen recommendations for a second term President Trump agenda, which is really built on codifying the actions that the administration has already taken of expanding coverage opportunities, universal HSAs. So one of the things, in addition to information for individuals, we want them to have the adequate incentives so that they have the incentives, they get the savings from being better shoppers of healthcare. I think one of the benefits, incidentally, of price transparency is that it would help employers establish benefit designs that are creative and that incentivize employees to be better shoppers of healthcare. We've seen one of the best examples out of the state of California, what they did for their public employees, where they set the reimbursement rate for orthopedic procedures. And regardless of where the employee went for a particular procedure, that's the reimbursement rate that the state paid. And what you saw almost overnight is that people started shopping. So they had a clear price, the reference point. They had an incentive to act on that price. They started shopping. That's not surprising. What is really good news coming out of that is that the high price providers, again, almost immediately significantly lowered their prices because they started losing market share. The really neat thing about this, and there are studies from Zach Brown at the University of Michigan and Christopher Wally at Rand Corporation, is that you don't need a lot of people shopping in order to have widespread benefits from that shopping. So Brown mentioned that if only 10% of people have information about prices, that should be sufficient to get providers to act on lower prices. And the California example that I mentioned, 75% of the benefit accrued to people who were outside the benefits, the public employee benefit structure, because high price providers lowered their prices across the board. So, price transparency, innovative designs like reference pricing, which really all states, including Texas, should model what California has done, and some other states with reference pricing models for public employees, to think about how to incorporate that in your state Medicaid programs to get Medicaid recipients shopping. And then anything that sort of expands the consumer's control. So I think a big reform would be if everyone could have HSAs. These are health savings accounts, tax preferred. People get benefits from growing wealth over time for when they need health care. Right now, you're limited to have an HSA if you have a high deductible health plan. So you have to have a specific plan with a specific deductible that has other requirements in order to have an HSA. Everyone should be able to have HSAs and save for healthcare that way.
Well, I tell you, one of the things we may see as a silver lining from all of the challenges this year is that these innovations that the three of you and many others have been working on tirelessly for years might actually be accelerated out of fiscal necessity. And so that's one thing that, as we look for optimism, as we always do in these conversations, that we can come to focus on. And seeing some of the audience questions already, which we'll get to in just a moment, I can see that that's very much on our audience members' minds as well. David, before we do that though, I just want to come to you. I know very well all of the things that you're working on, and it would be impossible for you to list them in a couple of minutes, but which one or two would you highlight, and which would you plead with our audience to help out with?
Well, I really want to talk about a solution that we have for the audience members and what we're trying to do. We're trying to educate people. But let me start off by telling a story. There was a colleague of mine in Georgia that talked to me about an employee that worked for her employer, and they were self-insured, and she needed to have a surgery. And the hospital quoted their price of $45,000. That would be what the employer would have to pay. Well, she just thought that was outrageous. So she decided to shop. And she came across an organization that many people know of called the Surgery Center of Oklahoma. And for the same surgery, and bundled up, it would include the doctor, the anesthesiologist, the facility, everything, soup to nuts. It was $4,500, 10%. And she went back to the hospital and said, I'm going to Oklahoma. And guess what their response was? We'll match it instantly. So that just tells you how much waste there is in the system and how much of a savings that we can achieve as consumers.
And how much power we have as consumers, right? And so
if we have the control, that's absolutely right. And so what we wanted to do at Right On Healthcare is we have, if you go to our page at texaspolicy.com/ROH for Right On Healthcare. We have
say that one more time slower for those of us who listen slowly.
texaspolicy.com/ROH for Right On Healthcare. And we've created a new tool that we will be building upon based on the feedback of people from all over the country. And it's a healthcare shopping list for those shoppable types of services. We're going to offer those providers and those facilities that are posting their prices publicly. And there's a good number. It's, whether it's pharmaceuticals, imaging centers, surgery centers, doctors, you name it. We're trying to provide as many tools and as many options that you can have for what you may or may not like to do the best job of getting the quality that you want at the price you want.
Very, very well said, and very exciting. So this has been great thus far. We're past the bottom of the hour, which means it's time to start taking some audience questions. So I see several already. I want to thank you, audience members, for pitching these questions to us. We'll work through them as quickly as we can so we can get to as many as we can. If you have a question, just go ahead and type it into the comments section of the social media channel you're on. First one is about the pandemic specifically, and I'll just read this one verbatim from one of our audience friends. How has the pandemic helped or hurt the battle for price transparency and affordability? Cynthia, you want to tackle that one?
Well, I think the pandemic, in a strange way, has shined the light, and there's a silver lining in it, in that it's brought ridiculousness in the wide variation of COVID testing and even COVID treatment into the light. And we've seen it on the news headlines about people being price gouged and having these outrageous bills. And as I said earlier, this has happened across the board. You know, people have faced bankruptcy because they got breast cancer, right? And these are hardworking people that have coverage. You know, if you think about the silver lining of the pandemic, is it's also shown us how many people have had their wages garnished, have actually lost their home, have faced, you know, extreme medical debt for years, and it's got to stop. And so the silver lining of the pandemic is that it's really mobilized this, and we see a movement. I mean, you're even seeing people on Instagram that are, you know, posting online how important it is to be able to see prices in healthcare. And so the American public is frustrated, and they do want to be empowered, and they know that that it's time for this type of economic stimulus for all of us, and it's just not fair. You know, it's just not fair that the consumer is blind to no prices and blindsided with outrageous bills and then expected to pay with a blank check whatever they're charged with no recourse because we never knew the price to begin with. And the beauty in this pandemic is this economic crisis is telling us it's now, it's here, it's got to be done. And I think we're in a moment for great change. And you know, the Trump administration has already made substantial inroads. Thank you, Brian Blase, while you were in there with a pen. And the president has strongly supported this. And, you know, it's just common sense. So I think it's time for pragmatic policy that is a populist policy, because it is a populist policy. We all get it. We're not naive. And now the politicians have to put the healthcare industrial lobbyists and lawyers at bay and do the right thing for the American people.
Thank you, Cynthia. Brian, what do you think about the effect of the pandemic on the possibility of getting some real reform done?
Well, I think Cynthia is right. I think broadly the pandemic has shed light on serious problems within America's healthcare system, including a lot of state and federal policies that restrict competition and providers from practicing to the best of their ability. So there's been a lot of restrictions on telehealth, both imposed by Medicare and also imposed by states. It really never made a lot of sense. And given that, you know, a lot of people couldn't go to the doctor for normal care, made sense for the government to relax so people could have greater access and choice of providers. Likewise, things like certificate of need laws, where you can't expand capacity because in order to expand capacity, you've got to go to a government board, which is often dominated by your competitors. That never made sense. It doesn't make sense. Con laws should all be repealed. But when you have a pandemic and you're afraid of access and afraid of a dearth of care, you know, a lot of governors took steps to relax anti-competitive measures like that.
Sure.
Interstate licensing, scope of practice. I mean, you can go on and on with things that states have done to relax rules to enable providers to practice and serve patients to the best of their ability.
And so the opportunity is for those to become permanent. And I know for those of us who work with specific legislatures, in David's case, not just the Texas legislature, but through Right on Healthcare, working in a number of other states now. David, and take this from the federal action with Congress, which of course is very important, especially on healthcare. That's really where this has to start. but explain for our audience the opportunities that are there for state legislative action, for the government that's closer to them, and ways that Right on Healthcare has been trying to amplify their voices.
Well, again, it comes back down to that relationship and getting the folks that don't provide as much value out of the way and mitigating their existence. The number one way to do that is transparency. This may seem off subject, but it really isn't. One of the issues that we had with the pandemic was PPE, having it available. Well, why on earth in a country like ours would we have a shortage of something like that? Well, it's because there's a manipulation of supply and demand in the supply chain that is limiting the ability of doctors to take care of patients. And those are things that can be done at the state level, principally by exposing many of these practices, fees, contractual relationships, and shedding some light on it. It's sunshine is the best disinfectant, and it's absolutely true for this industry.
It's certainly the best disinfectant in the legislative process. We know that. So switching gears slightly, and Brian, I'm going to come to you first on this question. This audience member asks, where are we regarding competition across state lines to be able to drive overall costs down?
So David gave a great example of the woman in Georgia who called the Oklahoma surgery center, was quoted a price, 10% of what her local hospital quoted her, and the local hospital matched. So I think you're going to get, interstate, for a lot of what people go to the doctor for and the surgeries that they have done, you can travel. And you see big companies like Walmart that have centers of excellence where they have chosen, a few hospitals and facilities in the country that do things really, really well, and they'll pay for their workers and usually a loved one to go there for their lodging, often with zero copay because those facilities are high value, high quality. So I think you will get more competition like that as there is more price information made available. I think that is increasing. We know that the Oklahoma Surgery Center serves a lot of people from outside the state of Oklahoma, and there are other centers like that popping up across the country who sort of want to reduce a lot of the administrative burden from dealing with third-party payers and from dealing with insurers. So I think it's still limited. It is growing, and I think the potential of price transparency is to really increase that competition across states.
Very good. We have a flurry of questions that have come in, so we'll move on to another question. Come to you, Cynthia, for this one. And this audience member asks, how could you implement price transparency in the cases of emergency surgeries when consumers don't have the opportunity to shop around first?
Well, that's a very good question about the difference between going in for emergency surgery and then elective. So the beauty in price transparency is that over 90% of our care, and it seems to be a big figure right now, the 90%, but over 90% of our care is non-emergent. Mm-hmm. So you can imagine when we benefit to see price variation in a market and quality variation, that will drive down the cost, but it will also shine the light on the differences between emergency care. So when a hospital, for instance, prices out the cost of the MRI or the CT scan or the blood tests, all the types of things that might routinely be presented in emergent care, you too will see the outliers, right? And the outlier price gouging will be mitigated, will be brought off or brought down because we will see what an all-in cost may be for emergent care over time. But in reality, when you're looking at over 90% of it can be selective and elective, that's a big deal. And that's where you can get the bulk of the savings and put pressure on the competition for emergent care. And we would also hope, because we've also seen extraordinary costs in ambulance fees, right, over the past several years. And we don't have sunlight there either. So the pressure will be broader than just hospitalization. It'll be the entire food chain, so to speak, or the supply chain of healthcare. So I think we'll benefit across the system once we have transparency.
Sure. And thanks for the answer. And that really excellent question. So Brian, a kind of related question to you. It's about legislative strategy. And Cynthia and David, you may want to weigh in on this as well. But we'll start with Brian. This audience member asked the very fair question. We touched on this. Why does this issue of price transparency need to be attached to the stimulus package that will no doubt have political hidden agendas wrapped into negotiations? It's a very astute audience member.
Well, I think we want price transparency as soon as possible, and that's the next major piece of legislation that Congress is considering, right? So that's sort of one answer. I think the second answer is, listen, past stimulus bills have given hospitals $175 billion in, some say bailout funds, others say relief funds, but they've gotten a lot of assistance, and we think it's time for consumers and patients to get some assistance from Congress. And really, all we're looking for here is transparent price information. This should not be an extremely high regulatory burden here to attach to, the subsequent piece of legislation that Congress considered.
Yeah, excellent response. I appreciate that. So David, we'll shift a little bit from price transparency and pose a little bit broader question, or at least a question for a specific segment of the population. And we, of course, deal with this in every state. This audience member asks, how will low-income families who cannot afford medical care be able to feel included in access to affordable medical care?
A lot of low-income families already participate in transparent pricing and shopping of healthcare. In Houston, where I spent a lot of years, the Hispanic clinics of the Latin communities would frequent are all cash. And it was exceptionally affordable, usually $20, $30 per person. And that was because they didn't have the infrastructure needed to do the billing and the collection to interact with the insurance company. We also think that some form of HSA or some form of spending card should be allowed for low-income families or even Medicaid recipients so that they can have broader networks than just the limited networks that Medicaid networks provide. There's some obvious obstacles there, but letting the patient then use those dollars to find what's best for them and their families without those restrictions is going to be helpful for them. It's actually a more humane, compassionate thing to do, as opposed to putting them in a box and saying, this is the sandbox that you can play in.
Yeah, and it strikes me, being an avid reader of Milton Friedman, as I know the three of you are and our audience members are, we often make the mistake, those of us who are in the policy world and are right of center, and saying quote unquote, introduce free market principles back into healthcare. Well, we generally know what that means, but if you think about it again on the sidewalk level, what everyone having a health savings account card or a spending card, if they're on an assistance program, would do is give them precisely what we want everyone to have, with the motivation of price transparency, and that's choice, the ability to make the decision. And we know that when consumers have choices, prices go down. So, and the quality of care goes up. It's just a remarkable thing. That's actually what we mean when we say free market principles. That aside, let's close with one final question from the audience, and then I'll ask you the question that I usually ask all guests regardless of topic, which is to leave us with an encouraging thought. But the last question from the audience is a real doozy. Is there a way to eliminate insurance companies and just pay for services? Cynthia?
Well, I think that's a really interesting point, because Brian a bit earlier spoke about the importance of the health savings accounts, the HSAs. And, one could imagine that when we have price transparency, visualize what that will mean. And if our HSAs can be fully expanded, what if, Brian Blase, those HSAs were expanded to what we're paying for insurance today, right? Instead of giving us an employer benefit of a health insurance policy, why not just put all that tax advantage money into a health savings account for that employee? Can you imagine? What I just learned recently from, again, Dr. Van Horn, is he said that 84% of Americans today do not spend down their deductibles, their high deductibles. So if we're not dipping into that insurance coverage because we're actually not totally, 84% of us aren't spending it down out of the deductible phase, you could imagine the savings and a whole new innovative platform that could be based on a cash reimbursement base, HSA, and maybe health insurance should look more like car insurance, where we pay for gasoline, we pay for windshield wiper repair, we pay for the care and maintenance of our bodies and our families, right? But we have a catastrophic type of insurance plan like we do in the automobile world. I just think there's all sorts of possibilities, and nobody boo-hooed when Netflix replaced Blockbuster, right? So I have to laugh.
Blockbuster, right? Which is the instructive point. Sorry to interrupt.
So I think we have this exciting opportunity in healthcare, and one could imagine, and I tee this up for Brian Blase, the economist on the panel, is can you imagine, and you too, Kevin, you know, my goodness, can you imagine how healthcare, if we're not spending down the deductible and we had all those funds in a health savings account, could we use healthcare as a jet fuel to propel the US into a savings economy? Think about it.
That's what I see, but I will defer to my economist friend, Brian Blase.
Well, so I love the question. I don't want to eliminate health insurance companies or the role of health insurance. I want the government to stop subsidizing and putting their finger on the scale in favor of comprehensive health insurance and third-party payment. Like right now, the tax incentives are strongly skewed in the direction of the system that we have, where the providers are separated from the consumers. If consumers want to buy comprehensive health insurance, if that's how they want to use their money, great. But I want to eliminate the tax advantage for those types of plans. So, I mean, I would strongly support, like, if we're going to provide a tax advantage for healthcare, one, that it be provided for healthcare, not specifically health insurance. People could use that to purchase health insurance if that's how they want to use their tax advantage. And it would be like, I think, a minimum tax contribution for the premium side. So let me tell you, the ideal arrangement that I would like is, because the Trump administration, we expanded these things called health reimbursement arrangements to address one of the problems that at most firms, the firm chooses the health insurance that all the workers at that company receive. There is no choice. Like, people are given one option of health insurance. Think about what other part of the economy that is a big purchase. You get one option, and the option is what your employer chose for you. So what I think is we should have HRAs where the employer is providing a contribution and the worker is using that to purchase health insurance. But it should be a fairly limited amount in the HRA, because we don't want to incentivize sort of too much comprehensive health insurance subsidized by the government, with an HSA. So an HSA is, people can use that on any type of healthcare that makes them best off. Cynthia actually offered another option, is that people could use their HSA to pay for premiums, which would equalize the tax treatment of health insurance.
Yeah, a lot of really important food for thought there. Hopefully we have the opportunity to work on that soon. David?
Like Brian, many people think I'm anti-insurance. That's just not the case. Insurance is appropriate if it functions like insurance. But as Brian said earlier in the live stream, what we have today is more prepaid healthcare, and it doesn't even do a good job of that. We need to fundamentally think about health insurance in a different way. And we need to focus on healthcare as opposed to health insurance. That's the biggest distinction. Do we want to do away with insurance? No, because there are big catastrophic things that, God forbid, may happen, and we want it there as a form of protection. But should it be the equivalent of your mortgage? Absolutely not.
Well, let me tell the three of you, what an excellent conversation. I was just thinking what an achievement the three of you have accomplished in making a healthcare conversation interesting and upbeat. And usually, especially for those of us on our side, we tend to be very pessimistic about these things, but I appreciate your optimism. On that point, I want to give each of you a minute, if you would like that much time, to close on a hopeful, encouraging thought. It's something that our audience members can do to assist you with your efforts. Is there a more general thought amid these very challenging times that you want to leave them with? We'll go in reverse order. Start with you, David.
All right. Something I say at every one of these, I take the opportunity to convey, and I'll do it every single time I have this opportunity, is that I want everyone to understand that when you hear a politician say the word healthcare, I want that to trigger something in your mind. They're not actually talking about healthcare. They're talking about health insurance. And what we've done is we've conflated those two terms. Health insurance is not healthcare, and healthcare is not health insurance. Healthcare is that relationship, is a service that we're getting to address the needs that we may have with our own health or the health of our loved ones. We want to empower you. We want to provide you with the tools and information necessary. And that's why we have that shopping list. And I'd encourage you to go look at it. And if you have any questions, please feel free to reach out to me via our website. And if you have any questions as to what you should do or anything pertaining to the industry itself, that's something I'm happy to participate in addressing with you as well. We want you all to be able to have what you need to make the best decisions you can possibly make.
Thanks, David. Brian?
So, I mean, I'm obviously biased here, but the Trump administration has done a lot of good to expand healthcare choices and competition. They've opened up coverage opportunities like association health plans, short-term limited duration insurance, these health reimbursement arrangements that I mentioned earlier, giving employers more ways to offer coverage to their workers. And what we talked about today, the price transparency rules. The hospital rule, which was going to be in effect in January, and which, as Cynthia mentioned, the first court held. There's another rule on insurance company transparency. They've expanded HSAs for direct primary care arrangements. I mean, there's a lot that the administration has done to expand choice and competition and sort of chip away at some of the problems with the status quo. And I think what those of us who support free markets, call ourselves conservatives or libertarians, we have to go out there and support these actions that the administration has taken and sort of convey more broadly the benefits of choice and competition and empowering consumers to reform our healthcare system. Because the other side wants to go the other way. Like, they see problems in the healthcare system, and their solution is we want to restrict choice and empower middlemen and bureaucracies
Thank
to
you,
restrain those choices.
Yes, very well said. Cynthia?
Well, Kevin, we are at such an exciting time because we've had so much positive momentum on this movement toward a very simple solution that all Americans want, and that is this healthcare price transparency and the ability to be empowered. And I think what's so encouraging for me, having founded patientrightsadvocate.org, is that our voices really do matter. And we have been heard. We were heard by the Trump administration, and they moved forward and delivered. And now it's time for Congress to deliver and act. And we can get it done very shortly in the coming days, if not weeks. But our voices are so of critical importance. So I'd go again to say the voices of all of your listeners and consumers really, really weigh in heavily toward affecting this change. So advocating yourselves or ourselves to write our senators, and especially Mitch McConnell at this time, because he carries a very heavy gavel to make this happen in the Senate and at the bargaining table, is to ask them to please pass the Healthcare Price Transparency Act in this next COVID stimulus. And again, they could easily do so by going to our website, patientrightsadvocate.org, click a button, put in your zip code, and it will automatically be generated there. And I'd say separately, ask Mitch McConnell himself, because we are at this time where Schumer and McConnell at that table will determine our ability to get this in. And should we get it in this COVID stimulus, Kevin, what's so exciting that as early as January 1st of next year, that's January 1st, 2021, we could all be able to be empowered and start shopping and reduce the cost of our health care and our health coverage.
And you talk about what a great silver lining of the challenges of this year that would be. So I encourage our audience members, if they're so inclined, to go to patientrightsadvocate.org and take those steps. And let me just say a couple of quick things. First of all, thank you to Cynthia Fisher, David Ballot, Brian Blase. You were excellent, as I knew you would be. I know our audience members appreciated not just your expertise, but the upbeat nature in which you address the challenges we have in this policy area, but also point us to solutions. So thanks for your time today. And let me close by saying to those of you in the audience that I hope what you heard today was a very sober, albeit brief, analysis of the problems, but a forward-thinking way of solving those problems. We're not throwing our hands up in the air and deciding that 2020 has made this worse. I think we need to start thinking about 2020 giving us opportunities that we would not have had otherwise. And today is the day that we can begin to take advantage of those. The other side, it seems, has done that for 50 or 60 years. This might be a lesson in strategy that our side uses for once. And I'll also say that what I love about the price transparency idea is that it gives us something to be for. As a conservative, I happen to love the advice that the late William Buckley gave us, which is conservatives stand athwart history and yell stop. There are a lot of things that I like yelling stop to. In fact, we often do that on this live stream. What we're yelling stop to in this live stream today is the status quo. But in addition to yelling stop, it's important that we be for something, that we be positive about solutions to what it is we're trying to stop. And I want to thank Cynthia and David and Brian again for giving us one of those solutions, which is introducing more price transparency in the system, which in other words gives you and me control about the prices we will pay. So thanks for joining us today. We will see you next week with yet another timely topic. To our guests, thank you to all of you who've tuned in. May God bless you. God bless this great country. Take care.